Association that'll keep that going. And then last Layla, which is more of a first aid, keeping somebody alive kind of situation, then she'll go out last. So here's Brianna Rich with the American Heart Association.
Serving as the Community Impact Director for the American Heart Association of Hampton Roads. I'm very excited to be here with you all today. We have been doing quite a lot of different things all throughout the area, so I'm going to talk to you a little bit about what we do and what we're trying to raise awareness for. So a little bit about me, a little bit about my background. I'm very passionate about community health, so I have my master's in public health with a specialization in health promotion. And ever since I've been out of school, that's literally all I've been doing things like this, talking to people, raising awareness. Once upon a time, a few years ago, I used to do home visits with patients that were at a higher risk for readmission to the hospital due to so many chronic diseases. So I like to say I've done it all. So I'm very excited to be here with you guys today. I'm trying to be quick. I have a lot of information to go through in a little bit of time, so I'm going to try not to keep you all too long today. So the first thing I want to do, I always like to start off my meetings with reciting our mission of the American Heart Association, and our mission is to be a relentless force for a world of longer, healthier lives. So what does that mean exactly? What does it mean to be relentless? Does anybody know what that means?
Never give up.
That's right. So that means we are never giving up on raising awareness on heart disease and the risk factors that are attributed to heart disease. Now, I know a lot of people probably think that the only thing we focus on is the heart. Is that what you guys think? No? Okay, good. A lot of people think that we only talk about the heart. The heart is all we're concerned about. But that is the case, but that's also not the case. We know that there are plenty of things that contribute to heart disease. We know that there are a lot of social determinants of health, which is what we call them, that can be attributed to someone being more at risk of heart disease. So our 5 key priority areas at the American Heart Association is, of course, improving blood pressure, as we've been talking about, and I'll talk about that a little bit more as we go on. The second is increasing nutrition security. Does anybody know what that is?
Being able to get the right foods?
Yeah, girl, yes, absolutely. See, most people say being able to get food, and that's very important. It is important to be able to get food. We have so many people that don't have access to food at all. But what we're working to do is not only give people access to food, but the right food that's not going to exacerbate any chronic conditions they may have, like high blood pressure, diabetes, anything else that they may have going on. Our third key priority area is reducing risk for women. So it's American Heart Month, and the Hampton Roads branch of the American Heart Association, we have our Go Red for Women luncheon in February. And that is our campaign that focuses specifically on women. Why do we have a priority area that focuses specifically on women? Anybody tell me why?
Heart disease is the 4th killer of women.
It is actually the number 1.
Number 1, it moved up?
Yes.
Oh my God.
Yes. But I do have some good news though. I did just see in some of our research that came out, it used to be 1 in 3 women, were victims of heart disease. It's actually now 1 in 4 instead of 1 in 3.
African American women or women?
Women in general.
Okay,
yes.
so African American women is even higher, right?
Yes, that is the case. And I'll talk a little bit more about some of the populations where there's health disparities once we, get a little more into the presentation. But yes, reducing risk for women, because a lot of people think that the number 1 killer of women is breast cancer. And I've actually heard that firsthand. I asked a couple of my friends and I said, hey, what do you guys think is women's number 1 killer? And they're like, oh, it's definitely breast cancer. And I'm like, it's definitely not breast cancer. So we have some work that needs to be done. Another key priority area of ours is eliminating tobacco and e-cigarette use. I hope I'm not stepping on any toes on you. All right.
Master of toes.
That's great. That's great. Yes, so there's been, of course, you know, we know a lot of people that smoke and use cigarettes, but there's been a major increase, especially among youth when it comes to vaping.
Yes.
So now y'all probably see people in the store. Yes, it is. It's really bad. It's really, really bad. I actually work with one of our school systems in Virginia Beach, and we worked with the superintendent there, and he let me know that the vaping issue is so bad there that they have to close the bathrooms in some of the schools, because students will go in the bathroom and they'll vape in there instead of being in class. So it's very, very
Y'all didn't want to know what she was thinking.
It's very bad. It's pretty tough, but that's something else that we're working on doing. And lastly, we're also working to improve our community response. So that's something that really came about with COVID. We want to know what's going on in the community and, you know, how we can still make an impact even with something like COVID happening. So we're working with our hospital systems as well when it comes to that. Any questions so far about anything that I've said? Okay, so now we're getting to the good stuff. So heart disease is the #1 killer for all Americans. And you know, there's a lot of misconceptions. People used to think back in the day that it was just a man's disease, more specifically a white man's disease. But African Americans, everyone is affected by heart disease. And if you don't have heart disease directly, I guarantee you know someone in your family that's suffering with heart disease. So we're all impacted, which is why we need to know the ins and outs of it. So, talking about high blood pressure. Y'all ready? Yes. Does anyone know what the normal blood pressure reading should be? When you go to the doctor and they take your blood pressure, does anyone know what a normal reading should look like? So the top and bottom number.
120 less.
Yeah, y'all are right. 120 over 80. That's right. Now I know you may go to your doctor and sometimes it might be in the 130 or like 120-ish, but really it should be 120 over 80. Point blank period, and that's from the American Heart Association. So for the go ahead.
Slow. If it's slow.
If it's lower, that's good, but not too low, because when people start getting like the lower numbers in like the 50s, 60s, that's really low. And your doctor will, you know, have that conversation with you. They'll be able to tell you when it's like super low. My sister actually has that issue. Her blood pressure goes up and down, so sometimes it's really low. Sometimes it's like 70 over like some crazy low number. So yes, that's important to make note of as well and make sure you're following up with your doctor. Thank you for mentioning that. Yes, ma'am.
The question I just have is, why is it that a person that's 17 or 18 years old has the same 120 over 80, and somebody that's in their 70s or that is the same measurement?
So are you asking, so a 17-year-old and a 70-year-old have the same hypertension reading, the same blood pressure reading?
That's the guide.
Yeah. So you're asking me, why is the 120 over 80 the guideline? That's a good question. I don't know the exact answer to that, but I'm happy to find it out. But since I've been with the AHA, which has been the last 3 years or so, that's always been the reading. I'm pretty sure, because everything that we put out to the community is backed by research, so I can guarantee you there's some sort of research that says when your reading is 120 over 80, then your arteries, the pressure that's a good pressure to have. If it gets any higher than that, then it puts you at risk for stroke and heart attack. The higher that it gets, and I'll talk about that later as well. Good questions, guys. Keep me on my toes. So I just wanted to go through the readings with you all as well. So 120 to 129, and any number that's less than 80 is considered to be elevated blood pressure. Not saying that you have high blood pressure if that's your reading, which is probably why when you go to the doctor and that's the reading, they don't really make too much of a big deal of it because it's just slightly elevated. And that can be for a number of reasons. I've been to urgent care and had like an earache or something. When you're in pain, your pressure is going to be elevated a little bit because you're in pain and you're not feeling good. So that's not too much to worry about. It's more so when it's on a consistent basis when you should be concerned. High blood pressure, hypertension stage 1 is when the top number is 130 to 139, or, not and, or if the bottom number is 80 to 89. A lot of people think that both of the numbers have to be high, but really it's one or the other. High blood pressure stage 2, bless you. If the top number is 140 or higher, that's stage 2 hypertension. Or if the bottom number is 90 or higher, that's stage 2 hypertension. So that's really when you see people taking, those high blood pressure medications to keep their pressure down. And lastly, hypertensive crisis. Anything when the top number is over 180 or the bottom number is higher than 120, you need to be going to somebody's emergency room, because that's stroke levels. And I really want to drive that point home, because people think that blood pressure is not something that they should be concerned about. It's the silent killer. That's what they call it. And they call it that for several reasons. One, a lot of people have high blood pressure, don't even realize that they have it, because typically it doesn't come with any serious symptoms. You may have a headache or something, but that can be attributed to not eating enough or not drinking enough water. You may not be thinking that your blood pressure is high. So that's why they call it a silent killer. So it's very important, if your blood pressure is really, really high, anything over 180, you need to get to the emergency room. And just a couple of statistics. So I want to pick your brain. Since we're in Norfolk right now, what do you think is the percentage of adults, so anyone 18 and older, what do you think is the percentage of adults that have high blood pressure in Norfolk?
In Norfolk.
Yes.
About 85.
Oh, it might, So let me say this. What do you think is the statistic that we actually can count? Because remember, high blood pressure is the silent killer, so a lot of people may not know that they have it. So they may not be included in the number that I'm getting ready to tell you. Y'all are probably going to be very surprised when I tell you the number.
70%, probably 65%.
Okay, I hear some good numbers. Okay. So actually in Norfolk, the percentage of adults 18 or older that have reported having high blood pressure, according to statistics, is only 31.7% of adults 18 and older in Norfolk. Now I want to tell you this, it is a lot, that's still a lot, but think about it this way, that number is absolutely, has to be, I guarantee you, much higher, because one, that number is only those that are reporting that they've been told they have high blood pressure. There are so many people that have high blood pressure and don't know that they have it, because one, they haven't been to the doctor. I know y'all know people that don't go to the doctor. She's pointing to somebody.
No.
I was supposed to don't call anybody out. So yeah, one, people aren't going to the doctor, so they don't know that they have high blood pressure. Two, depending on your provider, they may not be taking what your readings are as serious, because it may just be elevated and that person may not follow up adequately, or there's several reasons why these numbers are much higher than
So what
they
was the
are.
number I listed on?
31.7.
31.
Yeah.
Definitely.
It's higher for sure, definitely. So that's anyone that's 18 and older that actually reported having high blood
Right,
pressure.
and those are the ones that probably have insurance to go to the
Yeah,
doctor.
can't get their medications, go to the doctor. Yeah, I will tell you this nugget though. Now this isn't in Norfolk, but in Portsmouth specifically, about 75% of people that live in Portsmouth take some form of high blood pressure medication.
Living in Portsmouth will make you take out.
Just say it. Yes, Perry, you have a question?
You kind of answered it already. I was just going to ask
Oh, okay.
what was the percentages for other surrounding areas?
Yeah, oh yeah, I have those as well. So let me read those off to you. So Chesapeake is 34% of adults that have reported having high blood pressure. Hampton is 38.9%. Newport News 36.8%. Norfolk 31.7%. My PowerPoint is cut off, so it's not letting me see the others. But Suffolk, and I know this because I live in Suffolk, is almost at 40%.
Yeah. Is that by any chance broken down into demographic?
It is, but I don't have it with me right now.
You
I'm sorry.
forgot Virginia Beach.
Sorry.
You forgot Virginia Beach.
It's cutting off Virginia Beach, but I know that Virginia Beach is on the lower end. Virginia Beach is probably the
Yeah, because they
lowest.
hide everything.
Yeah. Somebody told me the same thing about Williamsburg.
They do. Virginia Beach hides
Yeah.
everything.
I
They
would say
don't report
this.
their information, so
Yeah.
it sounds like it's perfect.
But what's interesting to me is, you know how it is here, like you can be in Virginia Beach in 1 minute and then 5 minutes you're in Norfolk, so it's like those places are so close.
Right.
Why is there such a disparity, you know?
Same thing with Portsmouth and Chesapeake.
Yes, exactly. Yes, sir.
Don't most black people, I mean, isn't high blood pressure a problem among black people more than anyone else?
Yes, I get to that.
So the more black people you have in the world, the more.
Y'all are with me. Yep, absolutely. And that's why the American Heart Association, we're working so hard to get into, really all the cities in Hampton Roads. We're working with all the different cities to implement different blood pressure programs with clinics, providing blood pressure devices. I work with a lot of clinical partners just to make sure that they have enough blood pressure monitors so people can monitor their blood pressure at home. That's another big thing as well, being able to monitor your blood pressure outside of the clinic, because white coat syndrome is a thing. Y'all know what that is?
Yes.
Yeah, when you get to the doctor, you get all nervous, and your blood pressure is high, but it's not really high because you're nervous, and they give you this blood pressure medication that you don't really need, and that causes a whole nother issue. People need to be able to monitor their pressure at home, but blood pressure monitors are not cheap. A lot of people can't afford them. A lot of people don't even know how to use one, so that's why education is so important. Okay.
Any question?
Yes.
What is it when you have high blood pressure and you get a regular heartbeat? Is there concern with that?
I don't really know too much about a regular heartbeat, but I do know that it's, that's something that you definitely need to be following up with, not just your primary care doctor, but also a cardiologist as well. You definitely should be under a cardiologist's care. Yeah. Any other questions before we move over to some new stuff? Did I see your hand? I'm sorry, I thought I saw your hand up. Okay. All right. So we are going to talk about a lot of different signs for heart attack as well as stroke. So we're going to start with heart attack. Does anyone know what the warning signs of a heart attack are?
Swelling chest.
Maybe your left arm, maybe your pain in your left arm.
I heard chest pain. That's the big one.
Chest pain.
What else?
Shortness of breath.
That's a good one.
Sweating, profuse sweating.
What else?
Cold clammy skin.
Okay. What about nausea? Do y'all think that's a symptom?
Nausea?
Yes. Yeah. That's more so a symptom that's a lot of times more specific in women. And it's really important to know that because women and men often have different symptoms. A lot of times women don't get the chest pain. They might just be really sweaty. They might be really nauseous. A heart survivor that I work with, she almost didn't go to the emergency room because she thought she was just having a toothache, but really she was having really bad jaw pain and she was having a heart attack. So a lot of times you may not think that your symptoms are tied to a heart attack or something more serious, but what I always tell people is you know your body. So if you know that something is off, go to the emergency room, make sure you're following up with your doctor. If you're having like ongoing symptoms of like chest pain or anything, shortness of breath, anything like that, make sure you tell your doctor. Don't just attribute it to, I'm getting older, so my body is slowing down. No, you should always have a conversation with your doctor, anything that's, out of the ordinary. So symptoms for heart attack, you guys are right on the money. So discomfort in the center of your chest. It feels like uncomfortable pressure, squeezing. A lot of people that I've spoken to, they equate it to an elephant sitting on your chest. I don't know how they know what an elephant feels like, but I guess that's a good representation of how bad the chest pain is. Pain or discomfort in one or both arms, so it could be either arm, left arm or right arm, or both of them. You could also have pain in your back, pain in your jaw, pain in your neck. Because you think about it, all that stuff is, attributed to your heart. So you could have pain in any of those areas. Shortness of breath. This is also important to know what I'm about to say. That can be with or without chest discomfort. So anytime you're having any shortness of breath, you need to go somewhere and see someone, get medical attention as soon as possible. Breaking out in a cold sweat, nausea, feeling lightheaded. Those are also symptoms. And like I said, warning signs differ in women. So most times women experience these symptoms: shortness of breath, nausea and vomiting, pressure in the lower chest, upper abdomen. So that's not here, that's like right here. So that feels like more so indigestion. Jaw, neck, or upper back pain, dizziness, lightheadedness, extreme fatigue. Those are symptoms that are specific to women. And I also have a sheet here that'll talk a little bit more about that, and I'm gonna make sure you guys have that as well.